Corona is a illness. Yeah? It's epidemic and pandemic, and any disaster is affecting physical things. But beyond that illness or any disease or these things, they are widely and sweep the across the world and using a considerable degree of fear, worry, anxiety, tension, stress, and these are the actually present in our. So actually, these are the natural in human beings. They are natural reactions that if something have suddenly happens and happen in large population all over the world, so fear, anxiety, stress, they are present. They are present themselves in. So what happened in the pandemics and epidemics like corona and the disasters, they are sudden onset or certain prognosis, shortage of resources, imposition of unfamiliar public rules and restrictions on personal freedoms. They're causing the stress and anxiety. Large and growing financial losses, uncertain future. These are the secondary causes that affect the mental conditions of the person. Conflicting messages from the authority, like from government issues and many regulations, they are changing frequently, and local leaders, media, watching lot of information. So these are the things that are happen in this situation. And so we are as a healthcare providers, we are important role we address at the emotional level. We are the main tool which can take care of the public or the family or ourselves. We also deal our colleagues, your healthcare providers also. So public health emergencies affect the health, safety, well-being of an individual and as well as community also. Individual effect in terms of insecurity, confusion, emotional isolation, and stigma. I think stigma. Previously, my speaker told about stigma. Stigma is a very bad thing that hamper the actual normal life of a person and communities. In community, there are economic loss, work, closure of a school, and inadequate resources and deficient distribution of daily living necessities. These may cause the very high impact on and that the time of pandemic. So they may ultimately translate into a range of emotional reactions. These may be distress, these may be psychotic disorders, unhealthy behavior such as excessive substance abuse, self-harm, suicide, and many things they are happen. And non-compliance also is a very important thing. They are just breaking the rules, restrictions, and not follow the guidelines of the government and local public, local bodies. So extensive research in disaster mental health established that the emotional distress is equally affect the population all over the world. This is the thing that it will happen normally. It is happened previous the corona, after corona. So it is the disorder that they are the normal thing. That reaction, normal reaction of a human being that occur in acute conditions. So many studies reveal and then finally conclude that after disaster, most of the people are resilient and do not succumb to the psychopathology or any stress and that. But indeed, some people find new strength also. They become strength also after that disaster, these pandemics, epidemics. So it makes us strong also. So these are the things. But in medical condition like viral infections and other just a pandemic, endemic, they are different from the other technological accidents and natural disasters. In disasters, they are only PTSD or short traumatic, traumatic disorders like anxiety attacks happens. But in medical condition, these are life-threatening infection like corona, which is a viral infection. They do not meet criteria for PTSD only. They develop the psychopathology of depression, anxiety, and other psychological disorders. The recent studies show that the emotional outcomes from the pandemics are stress, depression, irritability, insomnia, fear, confusion, anger, frustration, boredom, and stigma is a very bad thing. Is a very important thing that happen in the stages of pandemic and epidemics. And also the associated with the thing that is quarantine. Quarantine also causes a very harmful psychological impact on the person or in any group of persons or in all of the community. Some group may be more vulnerable than others in the psychological effect of pandemics because epidemics, pandemics are happen. They affect the population as a whole, but the vulnerable population are affected more and causing they develop diseases also, and they need more hospitalization and other intervention also needed in these patients. In particular, people who contract the disease who are heightened risk are they are have already some problems. So people with pre-existing medical conditions, healthcare providers, children's, elderly, they are more risk. They are more at the vulnerable to for the psychological impact. So they need what they need. They need psychological assessment, monitoring, screening of mental health problems, psycho education, psychosocial support, and they inquire about the pandemic related stressors. So they should be inquired, especially where this it is focused on the healthcare providers. What have to do? They inquired about these symptoms also, these things also, to when they deal with the local community healthcare providers and personal patients. So they are inquired there. They inquire about the exposure to infected source, infected family members, loss of loved ones, and physical distancing. So this is physical distancing is a very important thing. Where the someone these days using social distancing. The actual word is physical distancing. So the history of physical distancing, the advice to physical distancing, and ask about the secondary adversities like someone have economic loss, not availability of food, not availability of shelters, not availability of loved ones. Ask about that. Ask about the psychological effect like depression, anxiety, psychosomatic repercussions. Sleep, ask about the sleep. Ask about the substance abuse. Ask about the very important domestic violence. How about the local environment of the family, and indicators of vulnerability. Are there pre-existing physical or psychological conditions, and fear and stress in children and adults. These should be inquired at first. The healthcare provider should be asked, any patient, any person, this should be asked. So after asking them, there should be some of the patient need only formal mental health evaluation and care, while other may benefit from the supportive intervention and well-being. They are also CBT. Also, we can do cognitive behavior therapy. Everyone can do CBT. CBT is only not any specific CBT, but we can told them about the illness, about inquiry, general knowledge about the illness. What is the precautions about the illness? These are the CBT points. We can reveal the things. What is happened actually? What is the virus? What is it? Virus is causing infection, causing disease in some persons. These are the prevalence, or we should take precautions from that. Apart that, nothing is corona or any pandemic. So this pandemic, epidemic, they're affecting the mind more than body. So um, the things attached to the pandemic, epidemic, these are the huge restrictions on the law and related to quarantine that causes the crisis, economic crisis, stop closure of the schools. So they are uh, creating very stress. One, they are inducing the self-harm, suicidal ideation. So they need more extensive psychological interventions like hospitalization also. And healthcare providers can offer suggestions for stress management and coping. So we are the middle body. If we have primary physicians and first contact healthcare persons, they can provide suggestions what have to do, what can do, what can they do. So we are addressing, we are people, we can intervene it at the primary level. We can help ourselves, we can refer them, and we can counsel them. So we also the link the patient to social mental health services, counsel the patient, seek professional mental health assistance as needed. So most of the vulnerable population is children. Children is more vulnerable population in this pandemic and epidemic era. They are fear of dying, fear of dying relatives, fear of what it means to receive medical treatment, what type of medical treatment given to the corona patient, to the patient especially infected by at the time of pandemic epidemic. So, and most important thing that They are the lack of things which are required for the good mental well-being. These are closure of schools, less opportunity to be with the friends and family, less social support. They are all the required things that are not required for the normal good mental well-being. They are deficient at the time of pandemic and epidemics. So, and the other thing is being at the home, increase risk of increased exposure to witness to interpersonal violence if there is incordial relationship in parents, in daughter, mother, in father, son, mother and son. If there is relationship is not good, then the child is more high risk for developing any psychological disorder and disturbances. So it is very concerning point that there's a patient family relationship should be healthy. Although children are perceptive to changes, but sometimes they may find difficult to understand these changes and express irritable anger. So a lot of time changes are really children are perceptive to change. They are enjoy the change if they are conveyed in easy way. They are in the manner that they understand easily. But sometimes they may find difficult to understand the changes. So children may they want closer to their parents. They make more demand on them. Some parents are caregiver may be under undue pressure also. So child only want to that their parents love them, parents make counsel them, parents understand them. But sometimes the child also may force the parents, and they feel also undue pressure themselves. So they are the bidirectional communications. So the simple strategy that can address the child, they include the giving child the love and attention that they need to resolve their fears. So first thing that the time when they are ever in the home, child not going to school, living together. So lot of things are happen in ongoing. So if the communication is good between child and parents, between brother and sister, between brother siblings, if the relationship is good, healthy, then nothing will happen. But if there is something problem in the relationship previously, after, so it is the time to resolve these problems, these things. So parent addressing the children that it is a good time to address yourself, to communicate themselves. So, and other thing is being honest. We should be being honest. We should be honest, not uh, escape the information from child. Explain everything to child. So explaining that what happens, and so they understand. Even they are young. The elderly so thought, yeah, we thought that child बच्चा को समझेगा नहीं. So we should explain the thing. What the corona, what the pandemics, what the happening about the illness, what would happen in the future. So we should tell him actually actual position, actual conditions, but not the gathering information. Sometimes happen that we are feel that like the number of cases are increasing, number of death increasing, the necessity of decreasing, no available kits, PPE. These are things. So these are things are causing more stress. So we explain the everything that these are the illness that happen there. In America, there are different situations. In our country, there are different situations. We gather information from the authentic sources and websites, and then we reveal the information to children. So we can convey the information properly. Parents also need to be supported in managing their own stress so that they can be model for their children. So the parents should be model because they deal the stress, they cope the stress. In manner the child learn how to cope with the stress. So these are the bio direction. Children helping to find way to express themselves through creative activity, establish routines. With this time they do establish the routine, the proper diet, proper some creative activities at home, some taking interest in food, and if a child is elder, then he participate in kitchen, participate in homemaking. These are the things that involved in that time. So if there is mental health and other issues, so mental health and psychological support received if needed. Do not stigmatize for that. And if we're talking about elderly, regarding elder people, also those underlying health conditions have been identified as more vulnerable. And to be told that you are very vulnerable can be extremely frightening and very fear-inducing. That older person are, we know that they are vulnerable, but we are telling again and again that you are vulnerable, you are vulnerable, you are vulnerable. That because extremely frightening conditions, and they are fear-inducing things. The psychological impact for this population can include anxiety and feeling stress or angry. So its impact can be particularly difficult for older people who may be experiencing cognitive decline or dementia. The patient with dementia and cognitive declines, they are particularly difficult because they are forget the things, then ask again, then fear again, anxiety again. So attacks are repeatedly. So these are more vulnerable. Some older people may already be socially isolated and experience loneliness, which can worsen the mental health. So we communicate the older person also. We should talk the older person also. We can share our fear to them. So we also the relief from that on their side. So on a project, there may be many things that the older can initiate themselves or with the support of a carer if needed to protect their mental health at this time. Because a lot of the elder people are easy to tackle the mobile phone, internet, so using them. So strategies for the elder people are undertaking the physical activity. We should look after for the physical and involved in the physical activities, keeping to routine for them, create, creating new one and engaging in activities which give a sense of achievements. We can talk about their achievements in previous life, in the, before retirement, and their young time that they when they are young. Maintain social connection is also important. So maintain social connection, but maintain still physical distancing. So some older people may be familiar with digital methods, and other may need guidance in how to use them. Same their mental health and psychological support and other services relevant to this population must be provided at the time. Most important thing is healthcare providers. The main thing is healthcare providers. What they do, what happened with them. Healthcare providers are also particularly vulnerable to emotional stress in the current pandemic because they are high risk of exposure to the virus. The virus is a novel nature, inadequate testing, limited treatment options, concern about infection and caring for their loved ones, shortage of the personal protective equipment and other medical necessities, longer duty hours, extended workloads, involvement in emotionally and ethically frightened resource allocation and decision making. So these are the points which are stressful for the healthcare providers at the time of pandemic, epidemic like corona. So the suggestion for the healthcare providers: self-care for healthcare providers involve being informed about the illness and risk. So being informed and informed from the authentic sources. These are the first thing that self-care for the healthcare providers. You can say self mental health care for healthcare providers. Monitoring one's own stress reactions and seeking appropriate assistance with personal and professional responsibilities and concerns, including for personal mental health interventions if indicated. Healthcare system also needed to address the stress and for the healthcare stress on individual healthcare providers and on general operation of monitoring reactions and performance. So if individual is affected, the system also is structured and modified according the giving the service to individual and also changing the different modify the rules for the group of the healthcare providers. So these are the responsibility of system. So the alternating assignment and duties and schedules previous one actually. So these are the measures taken by health authority and health personnel himself. Thing for the healthcare providers that COVID pandemic has the alarming implication for individual and collectively. In addition to providing medical care, healthcare providers have an important role in monitoring psychosocial needs and delivering psychosocial support to their patients. And ultimately, mental health care should be integrated into the general pandemic health care. These are line by WHO Regional Director Europe. The issue facing each and every one of us is how we manage and react to the stressful situation unfolding so rapidly in our lives and communities. Here we can draw on the remarkable power of strength and cooperation that we also fortunately possess as humans. And that is what we must try to focus on to respond most effectively to this crisis as individual, family, and community members, friends, and colleagues. And Baba Sahib said that cultivation of mind should be the ultimate aim of human existence. Support are needed, extensive mental health services, education training regarding the psychosocial issue should be provided to health system leaders, first responders, and healthcare professionals. The mental health and emergency management communities should work together to identify, develop, and disseminate the evidence-based resources related to social mental health and mental health triage and referral. Need special population and death notification bereavement care also at the time of pandemic epidemics. This communication effort should be anticipated and complexities of the emergency issues such as prevention directives, vaccine availability, acceptability, and needed evidence-based interventions relevant to pandemic and should address a range of psychosocial concerns. So the important slide that released by WHO for coping stress during the COVID outbreak. Thank you very much.